Thymosin Alpha-1 protocol, the immune peptide that cured long COVID in clinical trials, exposed, cold open a peptide with a 94% success rate for immune dysfunction, was fast-tracked and approved in 30 countries around the world. Doctors in Italy used it to save critical patients. China deployed it as frontline treatment. The clinical data was so compelling that governments rushed to make it available. But in America, blocked, buried, virtually unknown, and when you follow the money, when you trace who profits from chronic illness versus who profits from a cure, the picture becomes crystal clear. This is the story of Thymosin Alpha-1, the immune system reset button that Big Pharma does not want you to know exists. And by the end of this video, you are going to understand exactly why. Locked intro, welcome back to the Real Bio Protocol, the channel where we break down the science of peptides, fitness, and health optimization that most people will never hear about. Today, we are diving into something that could completely change the way you think about immune health and long COVID recovery. We are going to cover exactly how it works, what the real science says, the results you can expect week by week, and exactly what you need to do to get the most out of it. Stay with us until the end, because we are going to give you the full protocol. Let's get into it. What you are about to learn could be the difference between years of chronic fatigue, brain fog, and immune dysfunction versus getting your life back in weeks. This is the peptide protocol that doctors in 30 countries already know about. ACT1, the setup here is the reality nobody talks about. Millions of people are suffering from long COVID right now. The brain fog that never lifts, the fatigue that makes getting out of bed feel impossible, the immune system that seems permanently broken. And what does mainstream medicine offer? Rest. Maybe some antidepressants. That is it. They have no solution because they do not understand the mechanism. Or worse, they understand it perfectly and there is no money in fixing it. Long COVID is fundamentally an immune dysfunction problem. Your immune system got knocked off balance during infection and it never recalibrated. Your T cells, the soldiers of your immune system, are either exhausted or confused. They are either attacking everything including your own tissue or they are too depleted to fight anything at all. This creates a cascade of chronic inflammation, viral reactivation, and systemic dysfunction that conventional medicine has zero answers for. Now here is what makes this criminal. There is a peptide that has been used for decades specifically to restore T-cell function and immune balance. It has been approved in over 30 countries. It has peer-reviewed clinical trials showing remarkable success rates. And the average American doctor has never heard of it because it cannot be patented. ACT2. The science Thymosin Alpha-1, also called Ta1, is not some experimental compound cooked up in a garage. It was discovered in the 1970s by Dr. Alan Goldstein at the National Institutes of Health. It is a naturally occurring peptide produced by your thymus gland, the master controller of your adaptive immune system. The research is staggering. A 2020 study published in Clinical Infectious Diseases showed that critical patients treated with Ta1 had dramatically improved outcomes. Italian researchers found that Ta1 reduced mortality and accelerated recovery in severe cases. Chinese clinical guidelines included Ta1 as a recommended treatment based on positive results. But here is where it gets interesting for long COVID specifically. A 2022 study in Frontiers in Immunology demonstrated that Ta1 restored T-cell populations and reduced inflammatory markers in patients with persistent symptoms. We are talking about measurable improvements in fatigue, cognitive function, and immune markers within weeks. The success rates in various trials have ranged from 70 to 94% depending on the condition being treated. For immune dysfunction, for chronic viral issues, for long COVID symptoms, the data consistently shows this peptide works. Yet somehow the FDA has never approved it. ACT3, how it works, let me explain exactly what Thymosin Alpha-1 does at a biological level, because this is where it gets fascinating. Your thymus gland shrinks as you age. By the time you hit 40, it is basically a shadow of what it was in childhood. This is called thymic involution, and it is why older adults have weaker immune responses. Ta1 essentially replaces what your aging or damaged thymus can no longer produce adequately. Think of it like this. Your immune system is an army, and T-cells are your special forces. Ta1 is the training program that turns raw recruits into elite soldiers. It promotes the maturation of T-cells from their immature state into fully functional fighters. It modulates the balance between different T-cell types, so your immune system attacks real threats without attacking your own tissue. Specifically, Ta1 enhances T-cell differentiation and activation. It increases the production of cytokines like interleukin-2 and interferon that coordinate immune responses. It shifts the immune system from a chaotic inflammatory state into a balanced and effective state. For long COVID patients, this means the immune system finally gets the signal to stand down from chronic inflammation while simultaneously regaining the ability to clear residual viral fragments. ACT4, the protocol here, is exactly how Thymosin Alpha-1 is typically administered based on clinical protocols used around the world. The standard dosage is 1.6 milligrams administered via subcutaneous injection. For acute immune support, this is typically given twice weekly. For chronic conditions like long COVID, many protocols run for 8 to 12 weeks before reassessing. Injection sites are usually the abdomen or thigh, rotated to prevent irritation. Thymosin is reconstituted with bacteriostatic water and stored refrigerated. Most users inject in the morning on an empty stomach for optimal absorption. For enhanced results, many protocols stack Thymosin with other immune-supporting peptides. BPC 157 at 250 micrograms daily can support tissue healing and gut repair. Thymosin beta-4 at 2.5 milligrams twice weekly complements the immune modulation effects. Diet during this protocol should emphasize anti-inflammatory foods. Remove processed sugars and seed oils. Prioritize protein intake at minimum 0.8 grams per pound of body weight. Sleep becomes non-negotiable because immune repair happens primarily during deep sleep phases. ACT5, week-by-week results. Here's what clinical observations and user reports typically showed during a Thymosin protocol. Week 1 and 2, you may notice subtle improvements in sleep quality and energy levels. Some users report the brain fog beginning to lift slightly. This is your immune system starting to rebalance. Week 4 is where most people notice significant changes. Energy levels improve noticeably, cognitive function sharpens. That constant low-grade sick feeling begins to fade. Week 8, the compounding effects become undeniable. Many long COVID patients report feeling like themselves again for the first time in months or even years. Inflammatory markers on blood tests typically show measurable improvement. Week 12, the immune system has essentially been retrained. T-cell populations are restored. The body has shifted from chronic inflammation into balanced immune surveillance. Resolution. The payoff: you now understand something that millions of suffering people have never been told. Long COVID is not a mystery. It is immune dysfunction, and there is a peptide that has been restoring immune function for decades in countries smart enough to approve it. Thymosin Alpha-1 works by doing exactly what your aging or damaged thymus can no longer do effectively. It trains and balances your immune army. The science is clear. The clinical data exists. The question is why this information has been kept from you. Locked outro: the science is out there and now you have it. That is why we are here. This is the Real Bio Protocol. If you enjoyed this upload, do not forget to like and subscribe. Subscribing is completely free. Share this with someone who needs it and tune in again for the next upload. See you then. If you enjoyed this upload, do not forget to like and subscribe. Subscribing is completely free. Share this with someone who needs to hear it. Tune in again for the next upload. This has been the Real Bio Protocol.